Question 81. Following a motor vehicle accident, a man's right knee collided forcefully with the dashboard, resulting in a comminuted distal femoral fracture and a posterior knee dislocation. His right foot is pale and without a pulse. Based on this scenario, which vessel is likely to have been injured? Option A, posterior tibial artery. Option B, superficial fibular artery. Option C, popliteal artery. The likely injured vessel is the popliteal artery. Explanation. A posterior knee dislocation can cause significant trauma to the popliteal artery, which runs behind the knee joint. The popliteal artery is vulnerable to injury due to its close proximity to the femur and tibia bones. And dislocations or fractures can result in compression or direct damage to this artery. The absence of a pulse and the pale appearance of the right foot indicate compromised blood flow, possibly due to popliteal artery injury. The other options are less likely to be the cause of the observed symptoms. The posterior tibial artery runs behind the tibia bone in the lower leg, and is less likely to be injured in the context of a posterior knee dislocation. The superficial fibular artery is located on the lateral side of the leg and is not in direct proximity to the knee joint. Question 82. A 55-year-old man has been experiencing abdominal pain that has been gradually getting worse over the past 6 months. The pain intensifies after eating and is accompanied by fatigue, joint pain, and weight loss. His CT angiography shows kidney tissue damage due to reduced blood flow, along with multiple abdominal arteries showing aneurysms and sudden narrowing further down. Which of the following conditions is most likely? Option A, fibromuscular dysplasia. Option B, polyarthritis nodosa. Option C, infective endocarditis. Option D, thromboangiitis obliterans. The most likely answer is polyarthritis nodosa. Explanation. Polyarthritis nodosa is a rare autoimmune disorder. The symptoms described are typical of polyarthritis nodosa and result from widespread inflammation and organ damage. The bilateral renal infarcts suggest compromised blood flow to the kidneys due to arterial involvement, which is a hallmark of polyarthritis nodosa. The presence of aneurysms and distal abrupt cutoff in abdominal arteries is a characteristic finding in polyarthritis nodosa. Bacterial endocarditis, fibromuscular dysplasia, and thromboangiitis obliterans are different conditions that would not typically present with all the symptoms and findings in the scenario. Question 83. A 30-year-old man presents with visible blood in his urine which coincided with a past sore throat and fever that has since resolved. His kidney function tests are within normal limits: blood urea nitrogen 9, creatinine 1.0. His urine sample displays 15-20 oddly shaped red blood cells, significant protein, and a few clusters of red blood cell casts. Which of the following conditions is the most likely cause? Option A, immunoglobulin A nephropathy. Option B, acute tubular necrosis. Option C, Goodpasture syndrome. Option D, minimal change disease. The most likely answer is immunoglobulin A nephropathy. Explanation. The clinical presentation of gross hematuria, along with a history of a recent sore throat and fever, as well as the presence of dysmorphic red blood cells, proteinuria, and red blood cell casts in the urine, strongly suggests immunoglobulin A nephropathy. The other options do not fit the clinical presentation and urinary findings as closely as immunoglobulin A nephropathy. Question 84. In a case of chronic cough, hemoptysis, left-sided crackles, high chloride levels, elevated blood urea nitrogen and creatinine levels, along with microscopic hematuria and significant proteinuria, which diagnostic test should be considered? Option A, testing for anti-glomerular basement membrane antibodies. Option B, screening for anti-parietal cell antibodies. Option C, assessment of anti-mitochondrial antibodies. The most appropriate answer is Option A, testing for anti-glomerular basement membrane antibodies. Explanation. The clinical presentation described suggests a potential renal and pulmonary involvement. Anti-GBM antibody disease, also known as Goodpasture syndrome, is a rare autoimmune disorder that affects both the kidneys and lungs. The antibodies attack the glomerular basement membrane in the kidneys, causing glomerulonephritis. And they can also attack the pulmonary alveoli, leading to pulmonary hemorrhage. Question 85. A 32-year-old woman with a confirmed diagnosis of high-grade malignant breast cancer, a family history of ovarian cancer, and a BRCA2 gene mutation, is about to start chemotherapy. Which of the following contraceptive options would be most appropriate for her in this situation? Option A, copper intrauterine device. Option B, oral contraceptive pills. Option C, condoms. Option D, vaginal ring. Copper intrauterine device is the most appropriate choice in this situation. The copper IUD is a non-hormonal contraceptive that does not affect hormone levels. It works by releasing copper ions, which create an inhospitable environment for sperm and prevent fertilization. This option is safe for women with a history of breast cancer and BRCA mutations. Oral contraceptives and vaginal ring contains hormones that could potentially interact with the patient's cancer treatment or influence cancer risk. Given her medical history, it's best to avoid hormonal methods. Condoms are a good option, but the copper IUD offers longer-term contraception without the need for consistent usage. Question 86. The patient presents with menstrual irregularities, hypertension, and hirsutism, along with elevated androgen levels in the blood. An ultrasound reveals the presence of multiple small cysts in the ovaries. What is the probable diagnosis? Option A, gynecomastia. Option B, Kallmann syndrome. Option C, Klinefelter syndrome. Option D, Stein-Leventhal syndrome. The likely diagnosis is polycystic ovary syndrome, also known as Stein-Leventhal syndrome. This condition is characterized by hormonal imbalances causing symptoms such as irregular periods, excessive hair growth, and small cysts on the ovaries. The other options mentioned can be excluded because gynecomastia is the enlargement of breast tissue in males and is unrelated to the case. Kallmann syndrome is a rare genetic disorder characterized by delayed or absent puberty and an impaired sense of smell. It doesn't align with the symptoms presented. Klinefelter syndrome is a genetic condition in males where there is an extra X chromosome. It leads to infertility, reduced testosterone levels, and other symptoms. But it doesn't match the symptoms described in the case. Question 87. A 4-month-old child has sustained a third-degree burn covering 1% of their genital area. What is the most appropriate action to take? Option A, arrange a referral to a burn unit. Option B, apply antibiotic ointment. Option C, perform outpatient dressing. Option D, apply any over-the-counter burn cream. The correct approach is to arrange a referral to a burn unit. Explanation. A third-degree burn is the most severe type of burn involving damage to all layers of the skin and potentially underlying tissues. Burns located in sensitive areas like the genital region is particularly concerning due to the risk of infection, scarring, and potential long-term complications. Question 88. A woman has been dealing with a left breast mass for the past 9 months. A mammogram reveals a speculated mass with concerning microcalcification and involvement of axillary lymph nodes, categorized as BI-RAD5, indicating probable malignancy. What should be the subsequent action? Option A, proceed with excisional biopsy. Option B, opt for core biopsy. Option C, consider modified radical mastectomy. Given the suspicious findings, a core biopsy would be the most appropriate next step. Excisional biopsy involves removing the entire mass, which might not be the first step, especially when malignancy is suspected. Similarly, a modified radical mastectomy is a more extensive surgical option. and is generally considered after a confirmed diagnosis of malignancy.